I'm Javon Gray. I'm a certified nurse midwife and a holistic women's health provider. And today I'm back because I said I would. 2 lives, 1 week. I don't know what's going on. Just be thankful. No, I'm joking. I'm just feeling it. I'm feeling it. I hadn't been feeling it for a very long time, but I'm feeling it again. So here we are. This is my last little second. The last second that I could be talking about BV. No, not really. I'll probably talk more about it in the future, but that's the focus of this month, right? Is vaginitis, specifically BV. We're going to get into something else. Of course, it's going to have something to do with the vagina, of course, for March, but won't be BV. We're going to touch a little bit on yeast today as well, just because I feel like those are the main two. And some people are very confused about what the difference is between the two and that type of thing. So we're going to talk a little bit about that as well. So next month is not going to be yeast month. But anyway, we only got a couple days left in February. So I'm back to share the last BV chat for right now. So, today, I thought it would be most fitting. Let me make sure the people on Instagram are joining us. Yes. So I thought it would be most fitting to talk about how to know BV versus yeast. And if you have been following this series, I've been talking for weeks now about bacterial vaginosis. I had a special guest midwife on a couple of weeks ago. And so some of this information has been littered through there as well. We're going to bring it all together today, and we're going to talk about yeast. That is the plan. So the question is, because there's so much confusion around it, how do you know if it's BV or yeast? Because they're not the same thing, and they shouldn't be treated the same way. Now, again, if you were watching a couple of weeks ago when I was on with Cassandra, of course, the right thing to do in either situation is probably not to douche. It will probably create more imbalance. However, we're going to get a little bit into some of the treatment stuff. Mostly we're going to focus on clearing that confusion. And if you're interested, of course, talking about steaming services and stuff like that at the Three Rings Midwifery office. And so if that interests you at all, you think that might help to support you in regaining balance, vaginal balance, then feel free to message me or comment below. Either of those things will work. And then today's, what is today's comment? And I actually just, hey, white clumps and itching. Yeah, so today is clarity. Today is the message for clarity. So if you guys will message clarity, to me, that's how I know that you want to ask questions about this live specifically. Cassandra was on, and I missed some of her comments because I don't have sound on. Apparently, I just have, it's just popping up. But she says, hey, she said white clumps and itching. So yes, for sure, when it comes to yeast, yes, that's the most common presentation, though I have seen other signs of yeast without those symptoms and stuff like that. So that's why we're kind of like talking about what's up with the confusion and everything. But before we get into it, if you have ever Googled your discharge to try to self-diagnose for any reason, drop Google in the comments. I just want to see how many of us are doing this. I know that people Google multiple symptoms. I'm just wondering if y'all Google vaginal symptoms as well. So, why do people confuse them? How are they alike? BV and yeast can both cause discharge and odor changes. They both can cause irritation. And they can both be uncomfortable or cause discomfort, right? So we will talk about how those things show up differently, though, right? The root causes of BV and yeast are very, very different, and it's because they are different. They're caused by different overgrowths in different like vaginal properties or vaginal organisms. And the specific types of organisms can hint into how they're different, why they're different in terms of the symptoms. So BV is the bacterial imbalance, right? There's certain bacteria are more plentiful that usually are already in your vagina. Yeast, same thing. Yeast, it's everywhere. It's all over us. There's a lot, well, I don't know if it's necessarily all over us, but there's definitely a component of that in the vagina. The yeast is a fungus. There's fungal overgrowth, okay? There are different organisms, different mechanisms, and sometimes different triggers. And so if you do treat yeast like BV or BV like yeast, then you can make it worse, right? So like in a BV treatment, when you actually have yeast overgrowth, if you treat the BV, you might just decrease more of the bacteria, feeding into the domination of yeast and vice versa. Okay. So the typical BV and yeast presentation. So like Cassandra was saying earlier, with yeast, it's usually a thick white discharge. A lot of people say it looks like cottage cheese. Never really looked like cottage cheese to me. Cottage cheese is a little bit more wet than what I've seen for yeast. In the vaginal discharge, it's more of a dry feeling, like consistency, not necessarily feeling, but it's more of a dry consistency. And so Cassandra commented again. She said it's worse with HIV, and it is. Yes, yeast is in the throat as well. Thank you very much. So the mucous membrane areas for sure. Like, I mean, people will have symptoms of like fungal infections and stuff like that anywhere on their body. So, but it is sort of at home anyway, right? Inside of our bodies in those areas, and then it just overgrows. I actually don't know if there's yeast native to the oral mucosa or oral like environment. So if you do know that, then let me know in the comments. Thank you so much, Cassandra. She coming through, y'all. But usually there's also, or typically I should say, there's also like a certain amount of like itching or irritation. Oftentimes it's worse at night. When I've had a very or the most severe symptoms that I've had personally with the yeast infection, it was like out of nowhere, super itchy, right? Like it wasn't, I had like worked an overnight shift. I was driving home and it was just all of a sudden like completely unbearable. So this was like early in the morning. I hadn't slept all night. I drove straight from the hospital parking lot to an urgent care because I didn't want to like schedule an appointment and do all that other type of stuff. I didn't want to wait. This is something that felt very, 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 very urgent. Yeast also tends to cause like redness, and I don't know, I think it's maybe like the drying properties of it as well. Like it can really irritate, along with the itching. It can really irritate the vaginal skin, right? The vaginal mucosa. There can be some swelling with yeast. Again, that's the type of inflammation it can cause, and it actually, and for me, for like my personal body, like I usually will carry more of an odor than I did when I had a yeast infection. So it almost like it makes it less odorous. Like I can tell you that when I have smelled it, I don't know how to describe what it smells like. What yeast smells like. So Cassandra says, yes, I've seen it at its worst. You can scoop it out. Well, yeah, that's a lot. That's a lot. And if it is like to the point where it's like you have so much discharge, it's really copious discharge, oftentimes that in my experience, has come with more increased redness, swelling, right? Like the inflammation is also more intense as well. Whereas BV, we're usually looking at potentially no change in the discharge that is notable, or you're actually producing discharge in a more copious manner than you're used to, right? Because like some people will say, like, I don't even know, I've never had anything on my underwear. Like they just don't really produce very much mucus or discharge at all. And then all of a sudden they'll have this discharge. So sometimes it's normal. Like that's just what your cervix was doing, or that's just what that's just what your body was doing. Okay. But when it's coming with like a more like fishy odor, especially like a trash type of odor. And Cassandra said this a couple of weeks ago, and I say this as well because it can, especially if there's a product that is left inside of you, something that is not normally in your body that is inside of you for a long time. So things like a tampon, very commonly, I've pulled a couple of those out before. Condom, I don't know, like a piece of gauze. I mean, there are other things that you might put inside of yourself or whatever. And if you don't get it out, the amount of bacteria on it will accumulate and cause a very this is just, okay, when we say trash, if this is a trash can full of plastic and paper, it's not going to have a smell to it. But if it has, something that used to be living in it, right? We are bacteria heavy, animals. I don't know, humans, mammals. I don't know, whatever. Because we eat more than mammals, but the livers, the living organisms here usually are in more of like a symbiotic, or we're in a relationship with bacteria, right? They help us to live and do certain body processes, and then they live off of us and off the environment that our bodies create. And so the same thing happens with animals and things of that nature. And so when you put those things in the trash, whether you've cooked them or not, they will tend to have the bacteria that was in and on them proliferate and create that odor. So it's not like, because I feel like that word, like your vagina smells like trash, can be seen as negative, but no, really, it's I don't know. It makes sense. It is true. It is, and it's something. It's how our bodies are set up. It's how living things are set up and arranged. Irritation. The irritation that usually is accompanied, that we usually see when we have BV, is more of like a slight irritation, like a shift in your seat type of irritation, like I don't really have this much moisture on the outside of my body like that, excuse me, type of sensation, than it is like an intense itching. So you do have less itching with that. Okay, and we already touched on the odor. So not everybody is going to show up like these typical presentations, right? I've seen more watery yeast environments. I've of course diagnosed people with BV and yeast at the same time. I've seen people, like I said, have BV, have signs of it, and will just notice that this was what was happening after sex. They would smell, that they would produce an odor after sex because of how their bodies worked and the amount of discharge that they produced, etc. And like Cassandra was saying a couple of weeks ago, it's when it hits the air. It's when it hits the air that usually it produces more odor. So sex toys in the vagina, I think that's what she's talking about. Yes, that's a real thing. Yeah, and then the baby's getting a bad diaper rash. I guess we're talking about, is that a moisture comment, Cassandra, or is that a yeast type of comment. Anyway, because our bodies are nuanced, because our things can show up in our bodies in different ways. This is why guessing isn't always helpful, and this is why Google is also not always helpful. And there are also like I said, clinical features that a medical professional can help you clear up some of the confusion on. But why does recurrence happen? Because that's another thing that we were talking about. We're on a theme of BV, vaginitis, that type of vaginitis, and we were talking about recurrence. We talked about that a lot last week. So if you are interested at all in seeing that replay, then shoot me a DM with the word replay, and I will get you that link. But the vaginal microbiome, when you have recurrence, has probably not been stabilized. And by that, I mean that whatever it was that caused that shift for you in balance, you're either still doing it, or it was never quite righted. And we do see that sometimes, even when we treat you with like a medical, like an antifungal, right? Like a fluconazole tablet, or whatever, metronidazole gel, right? Recurrence can also happen because hormones fluctuate. And so when we're talking about, so this is a thing that I wanted to talk about too, when we're talking about vaginal discharge, because people often will equate changes in the quality or consistency of their discharge with some sort of infection or imbalance. And I think it's really important that we recognize that when your hormones are changing, right, because we do cycle as women, and when all of that stuff is happening, the qualities of our vaginas, of our discharge, all of that stuff changes as well. And so just because you have white discharge does not mean that you have a yeast infection, right? Just because you have vaginal irritation does not mean you have a yeast infection. I can tell you there so quick little story. You know, I don't really do quick stories, but I do have a quick story about because I've had this happen in my family, and I've had this happen with my clients, where they were misdiagnosed, where they were told they had yeast infections. They thought they had STDs, STIs, whichever one. They thought they had STIs, and they were being treated as if they had some sort of imbalance, right? Like they had yeast infections, constantly given these treatments to help with their itching, and they had lichen sclerosis, right? Which is a whole big old thing. You should Google that. What you think might be going on. And I can tell you that I literally had a pediatrician look at one of my family members, look at their vagina, looked at the vulva, I should say, looked at their vulva and said, this is yeast. And it was clearly like a discoloration of the vulvar tissue. The consistency of that skin was different. It was like, you know, textbook to me, but they just were not familiar with that particular condition, and like it did not believe me, did not this person, this doctor, did not write the appropriate prescription or anything like that. Like I had to ask to see someone else. I had to ask to see a pediatric dermatologist, because that person just didn't know that condition was a thing or what it was. She wasn't familiar with it. And so I had to, you know, because well, it's true. I knew what it was, period. I hate to try to diagnose. My family members always say that whenever they call me. But it's true. I knew what it was. And we can all make that type of mistake as providers if we are unfamiliar with something. We have this, we're talked about certain, like a whole huge list of different conditions, but what we tend to remember are the things that pop up most commonly, and the little known infections, diseases, conditions. Sometimes we kind of forget what they look like. And so, again, go ahead, get it all looked out, checked out, looked at, and everything to rule out some of the more common things. But again, sometimes you might have to advocate for yourself. But I'm saying Google is not the place to do that. If you have something happen, the treatment is not responding to treatment, then you should go back. You should talk to that person again, try to work it out with them, talk to somebody else about it, in order to get down to the bottom of what is going on with you, right? But specifically when we're talking about recurrence, when I say recurrence, I'm talking about every time you've gone to see a healthcare provider, you have been diagnosed with this thing, right? Like it's not the case that, we don't know what's going on with you or anything like that, but like every time you go, all the testing comes back positive for yeast or BV. Stress also can alter the immune response. Of course, HIV can alter the immune response. Cassandra said, we should always be swabbed and sent to the lab and looked at under the microscope. Exactly. Because you might have all of the symptoms. And I think I was talking about my personal experience last time, but I had everything looks like I had yeast. I don't know, y'all. My vagina's been through some things, right? It's been around for a while, but I have had cases as well where it appeared that I had certain symptoms, and I'm usually like watching wait unless there's something huge going on. It's unbearable, like I said, when I had to drive from my work parking lot to the urgent care. But if it's not, or if it's not symptomatic, if I don't have symptoms that make me feel very uncomfortable, I'm a watch and waiter. I am. Because like I said, sometimes things just work themselves out, especially if you just had a minor disturbance go on, something you ate. Cassandra brings up a good point when she talks about diabetes, because it does, like right in step with like lowering your immune response, diabetes, or even being pre-diabetic, increases the occurrence of yeast, right? Or, how many yeast infections you can have. Google or ChatGPT, that's another thing. Y'all, you are free to do what it is that you would like. All these things are readily available to you. You are the person who gets to make a decision for yourself. I'm here to urge you that if you're going to make a decision, for sure, about your health, and again, you are the person who decides if maybe what the suggestion is that you're getting from AI, or that you are, because there's a lot of stuff that goes on. Okay, boom. So I Googled BV discharge and I Googled yeast discharge just to prepare for this, because I don't think that I have ever Googled that before. But when I started to care about my discharge, I was already in nursing school and kind of learning about it. And so I don't think I ever did. But there are a lot of very confusing. So like you would think that you're like getting really good like resources here. Okay, here's a good example. So y'all can't see my screen. I ain't about to share it. Okay, so I will just describe it for you. One of the photos that comes up shows like bacterial vaginosis, candidiasis or yeast infection, and then trichomoniasis, which is a little known STD, but probably pretty prevalent. We just don't test for it that often, especially outside of pregnancy. But anyway, so it's showing this and what it looks like, but it's showing it from the perspective of like for trichomoniasis, for example, this is clearly a cervix, and you're never going to see your cervix, Oh, well, I can't say you're never going to see your cervix. I've definitely shown a couple people their cervixes, shown them how to look at them in the mirror, taking pictures of them when I found their cervixes, but it's not that common. You're not going to be able to do that at home. So like this will not help serve you. And let me see what else. Another image that I have, like, for example, somebody has a yeast infection, discharge on their finger, right? And it just looks like dry white discharge. It might not be, it definitely doesn't look like that cottage cheese. It doesn't look super dry, like, and curdly. You know what I mean? Like it, that I don't know if this is yeast or not. And I'm looking at it and I, you know, even as someone who looks at, who's seen discharge and then diagnosed yeast, sometimes it just be looking how it's looking, y'all. And then we go send it off to the lab. We still go send it off to the lab ourselves. Okay. Because we know that sometimes it looks a little bit different. And sometimes not everything that looks like yeast is yeast. You know what I'm saying? Yes, yes, yes. You kept a mirror in the clinic for those who want to see. Some people really do. And I will show them, like, especially for my fertility clients who are, wanting to get IUI and they're looking for a fertility sign. This is not a fertility talk, but the most common, maybe we should do fertility. If y'all want to see fertility in March, then I don't know. Let's just say draw fertility in the chat, and then we'll kind of go from there. But maybe we'll do fertility in March. Either way, for those clients, one of the hallmark signs of fertility, one of the best signs that you are ovulating, is that your cervix is opening. And sometimes you can tell by feeling it, but especially if you've never had your cervix open up before, like for labor and birth, that's a little bit more difficult to tell, but you can see when it starts to open. So sometimes I'll show people how to do it for that reason. Alrighty. So antibiotics, antifungals, they can treat the overgrowth, but they don't always rebuild balance. Okay. So what are some of the things that you can do to rebuild balance? First of all, a healthcare provider can rule out things like HIV, can rule out things like diabetes, and other health issues that might be contributing to the imbalance. There are, I know a ton of people who have done like elimination diets and stuff like that. Imbalanced stuff. Taking care of yourself, stress levels, like we talked about, because stress levels can alter the immune response. So maybe this thing that could have just been a little minor imbalance that your body could have righted, it didn't, because you're super stressed out. Seeing people have changes with exercise, and that can kind of swing either way depending, but it just depends on what your body needs. Does your body need more yin relaxation vibes, or does your body need more yang? Like, let's get to it. Active vibes. So steaming can also support circulation and tissue health. So vaginal steaming, yoni steaming, peri-steaming, whichever term you would like to use. Steam in general brings with heat, and it's not normal. Like when it's done right, it's not hot enough to burn you or anything like that, but it will warm up the area. The steam will help to promote circulation and support tissue health. And it's not a replacement at all for diagnosis. You should definitely, if you don't have a steam provider who is also a medical provider, you could definitely get, have somebody help you figure that out before you start to steam. But it can help to support and restore rebalance. So I'm going to check the chat again. Probiotics. Yes. Me. Yes. Go see Cassandra. But yeah, steaming can be super helpful. If you're unsure what you're dealing with, right? Like if this, if you're like, I don't really know, what my discharge is saying to me, get help. dealing with it, right? Because maybe it's not BV or yeast. Maybe it is a sexually transmitted infections, right? And so like you can get tested in offices. I do same day STI testing for people who are and so and I say this too because sometimes it can be more difficult to get in very quickly if you have a concern with the physician. And not all urgent care sites um, um, are as convenient to get like STI testing and stuff like that. Some of them don't provide it. And so you can go do like a virtual consult as well. There are, it's not just like my practice, but there are urgent care centers and health centers that are offering like virtual sessions now where you can call, get an appointment, same day, next day type deal, have a virtual conversation with them, and then, you know, show up to their lab and leave a urine sample or whatever to test for like gonorrhea, chlamydia, and stuff like that. So testing helps for sure. And then if you are dealing with recurrence, you know that this is, you know, you've been diagnosed with this multiple times, that is what this is, then that's when the more structured support plans make sense, right? So it's not like, okay, I think this has happened to me. I think this has happened to me. I think this has happened to me. It's like, no, like I know this has happened to me. I've been diagnosed more than once with this condition. I've had these symptoms and I want to figure out how to restore balance. That's when it helps to make a structured support plan because, again, the answer is not always the antifungal or antibiotics. Sometimes that's not even in the equation at all, right? That might not be needed. Many people can, just with supporting their body, recover from these things on their own. And if you want to learn how to or to test things out in terms of supporting the restoration of balance, then it would be more helpful for you to work with a more holistic practitioner. And so, I mean, I don't know, there are some pretty good like acupuncturists and like naturopaths and things like that who can help as well. But again, it just depends on your approach. But especially when we're talking about restoring balance, sometimes that takes a while. You know, you might have been doing something for a very long time, exposed to a product or some other element of your environment for a long time, some sort of other like mineral or other imbalance. You know, another comment that Cassandra had was like probiotics, right? So like you might have been deficient in one area for a long amount of time. And so restoring that sometimes can take a little bit more time. So that's what I have. We're wrapping up the month of BB and potentially moving into fertility. We'll see. You know, I'll keep my options open and decide last minute what we're gonna be talking about for March. But I'm thinking fertility. I like those vibes. Fertility, especially fertility and steaming. I can tell you that the very first home birth that I ever had with 3 Rings Midwifery, that client was like, yeah, I steamed actually before I got pregnant. I think that was why I got pregnant this time or whatever, you know? So, I don't know. That is one person's comment out of none of this is going to be a end all be all, and we'll probably need quite a few like methods, like a true collaborative effort, a true holistic effort in order to achieve fertility for some people. But it might be the right option for you and your family. So yeah, I'm talking myself into it. Let's do that for March. All right. I'll see y'all next week, next Tuesday.